So if we want to understand hearing loss, it's first important to understand how the hearing system works. Sound comes in through the external ear and goes through the ear canal and reaches the eardrum. The eardrum vibrates with that sound pressure, and those vibrations are picked up by 3 small hearing bones in the middle ear. Those vibrations from the hearing bones are then connected to the microphones of the inner ear. These are very, very small cells that take sound energy and translate it into electrical energy. That electrical energy is then taken along the hearing nerve to the brain, where it is processed for word understanding. There are several different kinds of hearing loss that a person can experience. The 2 common kinds we talk about are conductive hearing loss and sensory hearing loss. Conductive hearing loss is something as simple as wax that's occluding or blocking the ear canal. Another common cause of conductive hearing loss, where sound does not get to the inner ear, is when there is fluid behind the eardrum. This is a very common cause of hearing loss in children. In adults, a very common cause of hearing loss is something that is called sensory hearing loss, or hearing loss that affects the inner ear. And this hearing loss can be coming from problems with the microphones of the inner ear or the nerve that takes information to the brain. So we have 2 kinds of hearing loss, conductive hearing loss and sensory neural hearing loss. Conductive hearing loss typically can be fixed by either having the wax removed from the ear canal or draining the fluid from behind the eardrum with a surgery. The inner ear hearing loss, which is something that many adults suffer from, is something that is typically treated in a different way, such as with hearing aids. Now we can talk about different levels or severity of hearing loss. And with sensory hearing loss, that is when the microphones of the ear no longer are working, you can have a mild hearing loss, a moderate hearing loss, a severe hearing loss, or a profound hearing loss. A mild hearing loss would be one where it's difficult to just hear people when there's a lot of background noise. You have difficulty hearing soft conversations. At the other end of the extreme spectrum is profound hearing loss. With profound hearing loss, it would be difficult to even hear a train rumbling by. We can also describe hearing loss in terms of what sound frequencies are affected. The inner ear, where the microphones are located, is sensitive to picking up sounds that are ranging from very, very low tones, like the low keys on the piano, all the way up to the very high tones or the high keys on the piano. So the human ear can pick up a very wide range of sounds, and sometimes we only lose the sensitivity of these microphones for certain kinds of sounds. So some people might only have difficulty hearing very, very high tones, like children's voices or women's voices. Other people have difficulty hearing only low tones, so they have difficulty with men's voices, or they have difficulty hearing train rumbling. When we evaluate hearing loss, we typically obtain what's called an audiogram. This is a very specific test for checking the level of your hearing loss. Is it a low tone loss, a high tone loss, a mild loss, or a severe loss? This is the first step in determining how much hearing loss a person has. Now, there are many causes of hearing loss, and the most common causes of permanent hearing loss are the aging process and noise damage. We all have to age, we can't avoid that, but we can avoid how much noise exposure our ears are damaged by. There are much less common causes of hearing loss, such as exposure to toxic medications that would come from chemotherapy, for example. Sometimes head trauma can cause damage to the inner ears, but by far the most common causes of hearing loss are aging and noise exposure. Now, certainly there are other variables that can accelerate how rapidly our ears age over time. The most significant factor that affects the aging process is genetics. As we inherit our genes from our parents and our grandparents, those genes determine how sensitive our ears are to aging, how sensitive they are to noise exposure. So genetic factors can dictate how much hearing loss we have over time. Also, genetics can determine how sensitive our ears are to sound. Is there a way that we can prevent hearing loss? Absolutely. We can protect our ears from noise damage. And the most important things from this are to start early in our protection. Noise damage to the inner ear is like sun damage to the skin. Sun damage and sun exposure that we get at young ages, when we're children or teenagers, results in skin cancer when we're in our 40s and our 50s. And it's the same with noise exposure. The noise exposure to firecrackers, loud guns, our music turned up loud in our iPods, all of those cause noise damage to the ears when we're young and results in more hearing loss as we get older. How do we know how much sound is too much? When is a sound too loud? We measure the loudness of sounds in what's called a decibel scale. Typically, the soft whisper of a voice is considered 30 decibels. Conversational speaking, such as what I have now, is 50 decibels. Noise traffic on a street is about 70 decibels. A rule of thumb is anything that is 90 decibels or greater can only be listened to continuously for 8 hours or less before it causes noise damage. So a power saw, which is 110 decibels, can only be listened to for 1 hour at a time before it will start causing damage to the inner ear. So it's very important to protect your ears from noise damage because this can prevent hearing loss when you get older. It's also important to control other health factors. So healthy living and controlling cholesterol, diabetes, and high blood pressure will also significantly prolong the healthy life of your inner ear. If you think you have hearing loss, the most important thing is to go to your doctor and have your ears evaluated. You may need to request an examination by a specialist, that is, someone who specializes in ear problems and hearing loss. There's very good resources on the internet to help you learn more about hearing loss and noise protection, and these websites will be available to you on the website.